So you've had breast implants put in, you've lived with them, and now you want them out. And this could be for a variety of reasons. One is that you were happy with the breast size that you had, but now you really don't need them, and you like your breasts to be smaller and lighter. Another is you might have trouble with the implant or with the scar shell around the implant, leading to capsular contractures or implant malposition, and you just say, you know what, I'm done with this. Let's get back to just my regular breast without the implants. Some women have symptoms that are attributable to the implant and the capsule. So whatever the reason, we can go ahead and we can take out the implant. We can take out the scar shell or the capsule around the implant if we feel that that's contributing to the issues, and restore your breast volume by doing things like fat grafting, where we do liposuction to your problem areas and then selectively placing it into the breast to restore some of the volume back, and also by doing a breast lift to remove some of that extra skin. Understandably, if we put in an implant and it stretches out the skin over a period of time, we take out the implant, the breast might appear a little bit deflated and saggy, so by doing a lift we can restore better aesthetics for you. So whatever your reason for wanting to take out your breast implants, we can go ahead and do that for you and still restore your breast shape and potentially your breast volume to make you happy.